Hello and welcome to another episode of We the Doctors. My name is Dr. Jules.
Welcome, and my name is Dr. Valeria.
And I'm Dr. Yvonne.
And I'm Dr. K.
Yes, it's time for your favorite doctor's show, Doctor's Appointment on television. And you know how we do it. We try to simplify anything and everything that has to do with your health. Today's topic is something that most people have a problem with when it comes to making a choice. So we are going to be talking about the types. We'll simplify it for you, okay? We're talking about contraceptives. Yes. Lots of people have problems making choices, and there's a lot of fear when it comes to the side effects as well. So we are going to simplify it for you. We'll be giving you illustrations because we have samples in the studio. And of course, we'll be talking to a guest, and Dr. Valeria will be giving us tips for where they are not doctors. So let's kick off the show. I'll start off by defining what contraceptives are. So simply put, they are methods or devices used to prevent pregnancy. It's very, very simple. And there are different types. So let's talk about the types just to help you out, okay? The natural type.
Yeah, talking about the natural one, that's my own preference, so to say, because you know that there are no complications whatsoever, no side effects. And you know, if the most popular type of the natural method. Anyway, natural method simply means that you don't have to take any drugs or do any surgery or anything. Basically, it just means that it's natural. That means you're the one preventing it. Exactly. And then the most common one we all know is the withdrawal method. Really, that's, I mean, if you're very good at it and you're sure that you can just come out as fast as possible.
Can you really be very good at it?
That's up to you.
Failure rate is high.
Yeah, but we know that. Then that's when people start talking about pre-seminal fluid and all those plenty things. That's by the way. Anyways, failure rate, yeah, could be high, but it depends on how skillful. Some men are more skillful than the others. So, then the other natural method that I mean, I think a particular religious organization tend to prefer this. I think they make reference to what they call the Billings method. Yes. Yeah, and then this is when a woman understands her cycle. True. All right, she has a regular 28-day cycle or maximum like 32 or within 26 to 32 days, and then she knows when she's ovulating. She knows when she's not ovulating. All right, and then she makes out when she knows when she's not ovulating. She can make out with her husband. The husband knows that when his wife is ovulating, that is not the time to go near her. True. Or maybe even if he goes near her, then he can probably use the withdrawal method, whatever it is.
But not to attack your preference. When you talk about natural methods, one will wonder how meticulous could people be in keeping the charts?
Yeah, it's really easy.
Do that, you definitely
it's not easy, to be honest, but you know,
that's why we're saying failure rate is really very high, because this is you're doing it yourself. Yeah. There's no assistance in the form of medication.
Now, apart from the natural methods, there are many other methods. For example, you can use hormones.
Yes.
Okay. And it's just very simple. You run chemicals that just intercept or interrupt. Okay. Or as the ladies would like to say, disrupt their menstrual cycles.
Yeah, so I think the hormonal method is one of the most common methods.
Yeah.
Sometimes they are tablets, sometimes they are injections.
Coming up next.
There are methods that we use to prevent pregnancies, unwanted pregnancies, if I may say. Hello and you're welcome back to We the Doctors. This is the illustration segment, and we've been talking about contraceptives. For those of you just joining in, if you don't know what these are, they are methods that we use to prevent pregnancies, unwanted pregnancies, if I may say. The thing about contraceptives is this: for maximum results, some things have to be put in place. Most times it's best that your healthcare giver is the one that actually tells you which one to use, because different things work for different people anyway. Your healthcare giver must be involved, because most times they have to insert if they are not giving you the tablets or whatever to take. Then also correct usage and consistency. Without this, it may not work. We have a lot of them that we're going to be talking about in this segment. Earlier we mentioned them, the barrier methods, we mentioned the hormones, and so many others. And we're going to be talking about their side effects. As you can see, we have some of them actually displayed on our tables, and we're going to start with the barrier methods. So, Dr. Jules.
Thank you, Dr. Yvonne. Okay, we're going to start with the barrier method. These are condoms, okay? We have the male condom, and we have the female condom. Yes, we do have female condoms. I'll talk about the male one first. Their method of, the way they work, basically, is they prevent the sperm from getting to the egg, okay? By egg, of course, I mean the female.
Yes.
The female egg. So, I'm going to open one. Yeah. Okay,
Dr.
they're
Jules,
very, very slippery.
It was quite easy to open. Looks like, you know, I'm just saying.
Don't mind, please.
You're just trying to see.
I'm an educator.
Of course.
So, of course, you want to look at the expiry date anytime you get.
So the expiry date has a role to play too in this business.
Of course.
Yes,
because of,
okay.
It's just being silly. Of course, because the condoms can break, okay, if they've expired. So you want to check, okay? And then it has a little tip at the top, and then it rolls outwards. So you want to make sure you're not putting the wrong side of the condom. And the only way you can know that is if you look at the ring. The ring should be outside, not inside. This is the wrong way. Okay?
I'm learning.
Like this. And another, it's 85% effective. The only shortcoming of this is if you react to latex, that's what the condom is made of, the person might not be able to use it. Another way somebody can know if they react to latex, if you wear gloves, or gloves that we use in the clinics, they are made of latex as well. So if you react to that, that's a shortcoming. It can break, so the expiry date. The female condom, on the other hand, is much bigger. It's more expensive than the male condom. Male condoms are very easily accessible. Pharmacy stores, very, very cheap as well. As you can see, the female condom is much bigger. The advantage of using this, the woman is in control. She can wear it 8 hours before sexual intercourse. That's a long time, okay? And it's safe. If she, 8 hours. Now, there are 2 rings. One is very flexible. Another one is almost like a bangle. It's very firm. This is the part that goes into the woman's genitals to the roof. She squeezes it this way, and then it goes in, and this stays outside. Okay? Most women that are used to putting on things like tampon, I'm sure it will be very easy for them. I would not suggest this type for somebody that is probably like a virgin or something. It will be very difficult to use this one. And like Dr. Yvonne said, you need your healthcare practitioner to choose your condom or your contraceptives for you. So that is all about the barrier method. Okay, and we have some interesting things on the table as well. So
yes, absolutely. We have the pills. Most of my young girls know about this one. Very convenient. Yes, absolutely. It's about 99% effective, really. You know, you just take your pills every day, basically. Yeah. But then again, you got some side effects and it has some benefits. Benefits, you know, that you have decreased risk of ovarian and uterine cancer, ovarian cyst, and what have you. Decreased pains when having your menstruations and all of that. But then again, some of the side effects, weight gain, sometimes bleeding in between periods and all of that. So that's one of the reasons why it's imperative for you to know which one works for you, really. Exactly. Now, another thing that says, if you are just starting the pill, you want to make sure that you use condom for at least that month when you're just starting off. And if you're taking antibiotic, it's better you use the condom, right, when you're taking the pill, because then again, it might not be working at that point in time. Now, if you miss one day, please use condom for 1 week before you continue taking of the pill, so that you will not make any mistake and all of that. Now, we have one very interesting one here that I just came across, the beads.
Yes.
Now, I thought this one was the bead they used to wear around the waist. But apparently, this is the cycle beads. So it's got a ring around it.
Yes.
There's the red part here. There's the brown part. And there's the white part. All right? Now, the day you start your period, you'll have to pull this ring on the red part.
Okay. That's the first day of your
of your menstruation. Yes. Yeah, of your menstrual cycle. you put this ring on the red part. And then for each day, you mark that day on your calendar. Now, for each day, you keep moving the ring. All right? Please, you have to make sure that you do not forget to change the ring. If not, the day you think you are safe is the day the pregnancy will enter.
Dr. Valeria, can you hold it up a bit so that they see the ring?
Yeah, this is the ring right here.
Just hold it up for a few.
And the ring is on the red part.
Just hold it like that.
All right? You can see it. And every day, the next day, you move to this side. Now, the thing is this. Anytime this ring comes on the white part, please don't go there because there's a risk of getting pregnant. But when it moves from the white part, again, back to the brown part,
you're good to go.
You can go ahead and do like that.
Yes.
You know what those ring on that ring,
sorry, Doctor. Okay, I forgot to mention something that barrier contraceptives protect from sexually transmitted infection.
Yes.
I think it is the only one that does that.
Yeah, basically that's
but this one does not protect against sexually transmitted infection. Just pregnancy.
No, but it's important. Contraceptives are meant to prevent pregnancy, not necessarily sexually transmitted infections.
Yeah.
So when barrier helps, it's
just a beneficial.
That's a plus for
Exactly.
And talking about those rings, I wonder why the safe days have to be white. It's like your holy days.
Exactly.
I know, the sacred day. That's a beautiful thing now.
Anyway, when you hear women talk about loop, coil, whichever word they choose to talk about, this is basically what I talk about. It's,
let them see.
If you look at it, it's just a tiny T. It's made of copper. So what I have is copper T. Yeah, we call it IUCD, intrauterine contraceptive device. Basically, what this means is that we'll put it inside the uterus, just as the word has said, intrauterine. Now, this is one method that you need your doctor to help you with.
Definitely.
For the barrier methods, you get to use them at home. You discuss what to use them at home. Sure. When you come to the tablet, you can take them at home. But I don't see you putting this yourself.
Oh, just come on to me. Come to the hospital.
Basically, you go to the...
exactly. You go to your doctor, absolutely.
So you go to the hospital and the doctor gets to put it for you. How does it work? It deceives the brain by making the brain believe there's already a pregnancy in there. So when the deception occurs, you will definitely not get pregnant. Very effective. Exactly. In fact, as effective as 98% when inserted by a doctor. Wow. Look at the tricks about this. There's a tiny coil after the T that the woman can get to feel. Some say they're not very comfortable feeling it. So in the hospital, we'll get to reduce the length of the coil. So once the lady can't feel it, she now knows maybe it's missing. That's when you hear women say, I have a missing coil. You go to the hospital, the doctor finds it for you and it's back there. When you use this, for 10 years, you're fine. So it's one insertion for 10 years.
That's copper T.
Yeah, copper T. Yeah. When you IUCDs also have the type that you have chemicals, just as what you described, added to them. Those ones will last just about 5 years. Levonorgestrel, no big names. Just get to the hospital, doctor helps you choose which one you want to use. Now, the ones that have the chemicals on them will last just for about 5 years. The ones that don't have these chemicals, like this copper T they have, for 10 years you are fine. What are the side effects? Basically minimal. You can have a few cramps. Women are already sometimes used to it. It's not good that they're used to it, but are sometimes used to having a few cramps. So you have a few cramps with this. Some women complain of some form of bleeding. And if not carefully or inserted in a sterile manner, you could be exposed to infections.
Some form of infection. I was going to mention that as well.
And lastly, I would like to talk about this. As you can see, these bottles here, they are called the injectables. I have them in my hand here, commonly called shots. Like the name says, injection anyway. So it's usually given, of course, to women in the muscular areas of the buttocks or the upper arm. There are two of them here, and they contain progesterone. This one is called Depo-Provera, and this is Noristat. This one is given every 2 months. This one is given every 3 months. Like I talked about consistency. So if you break it, then there's a problem somewhere along the line.
So it means that you don't have to bother yourself with going to look for condom or look for pill. Just take injection and you're covered up for the next 3 months.
Exactly.
You know the trick is, that's the good part. She brings the injections and refuses to bring the syringes.
I'm not giving anybody except you want to have some shots.
Exactly.
We have a syringe at the background, so that should serve.
Yeah,
but we don't have the implants, though. No, that would have been another nice one to talk about. And cervical caps and all of that, basically. But go see your doctor, like you said earlier.
And the side effects with this one, like Dr. Valeria talked about before, weight gain. Many women are scared of weight gain anyway when it comes to these kind of things. They don't want wahala. There's also the issue of breast tenderness. that will happen. Then also there could be infection at the injection site. Then the one most people don't want to play with is abnormal menstrual flow. Let me put it that way, because your menstruation now becomes inadequate, and sometimes some people don't even menstruate again. Some people like it anyway because some people feel the inconveniences of period every month.
You are even mentioning it now so that they can make that association.
I once explained that to one of my patients, and her response was, "Who wants the menstruation anyway?"
That's what I'm saying. That's what I'm saying. But at the end of the day, if you stop it after the effect of the progesterone wears off, the menstruation will come back to, as in it will come back.
Absolutely.
Anyway, it doesn't have any harm whatsoever.
Yeah, so, I think what's basically important about these contraceptives is women are worried, would they get pregnant when they start using them? When you're using the contraceptives, no, you won't get pregnant if properly used.
Exactly.
But when you stop using, if you want to achieve pregnancy, it's still possible.
Yes, it's possible.
They use a contraceptive, except you've done sterilization and tied the tubes, as we used to call them, the permanent ones. We don't expect you to get pregnant if you do that, because you can't really stop them. It's a long procedure to reverse. But for these, once you've stopped,
that once you stop, you stop. So, and so many other side effects that we will not be able to take on this particular show. But as usual, you know, we always like to hear from people on the streets to know what they think about our topic at hand. So we'll be going over to the streets now to hear what people have to say about contraception. Please do not go anywhere. Stay tuned, because we'll be right back.
Really, but it should be the woman, you understand? Because some men, they don't care if you have baby in 2 years or in a year plus or something, but it is you, woman, that carries the pregnancy, you know. So the woman should be in charge of that.
Both, because there's a saying that says it takes two to tango. If the guy is doing it and the lady is not doing it, there must be maybe a miscalculation might occur and something. But if both of them are doing it, then there's plus or minus that it will be very minute.
The man. Why? Because it's the cause, so it should prevent the woman from unwanted pregnancy.
It takes two to tango, so I don't think there's anybody who's supposed to take sole responsibility. I think it's the responsibility of both parties. That's what I believe. That's my take on it.
Both of them. Why? Both of them should. Unwanted pregnancy, that means you're not ready. If I'm not ready now, I say to my husband, I'm not ready for pregnancy, and we work things out. And I think it's better like that. Not just one party, both of them must agree to it.
It's both parties, because they are two already, becoming one. So one cannot take the decision why the other one is being left behind. At least it's going to be, it should be a couple thing. That is the husband and wife. They are the one to take the decision based on the agreements.
I think the woman, because she's the one that is going to she's the one that is going to face the embarrassment. So I think the lady should be the one to prevent herself.
It's the man. It's the man. It's the man. The man supposed to take the responsibility, because you know, when woman is pregnant, you know of us can this thing they, so woman the man supposed to be the responsibility.
Unwanted pregnancies, both should take responsibilities. I believe when a man and a woman decide to have sexual intercourse, one way or the other, they should expect pregnancy, and so when something like that comes up, both should be able to take their responsibilities.
It's on both sides. Either side could be weak at a point, so when one is weak, the other is expected to be able to have control over sexual issues. So I think it's on both sides. It's not dominant on any of the gender.
All right, welcome back to your favorite show, We the Doctors. If you're just joining us, this is We the doctors said that earlier on, we've been talking about contraceptives basically. It's been an interesting one, sampling the different types of contraceptives. Basically, this segment we're going to be telling you what to do when you already have a failed way around it, basically. We're going to be talking about emergency contraceptives. In other words, if you've had a failed form of contraceptive or you had an unprotected sexual intercourse, the things you can do to prevent yourself from getting pregnant, prevent unwanted pregnancy, basically. I think we know the most common one, which a lot of people do. Dr. Okay? Yeah, in that
basically, when people want to prevent pregnancies after they've had an unprotected sexual encounter, the commonest is what we call the morning after pill. So it's single tablets. In some formulations, you have 2 tablets. You just take it. It's most effective within the first 72 hours.
Yes, absolutely.
So the closer to the sexual encounter that you take it,
the more effective
it is. If you stay longer, the possibility that you may fail. But it's best.
Please, and the problem now with this one is that many people will hear this now and start taking it every morning. So after sexual intercourse, in the morning you take it. After, please, it's not taking that one. Thank you, please.
It's true.
Yeah, but also
because these things are hormones and they can disrupt your
they can disrupt your whole system and your whole cycle. Some people take it immediately after having an unprotected sexual intercourse. Some people take it because it's a failed, contraceptive. For example, the barrier method, you were talking about the condom, busting and all that kind of thing.
The condom wasn't properly
used. Exactly. And then you have to probably take the emergency contraceptive pill. But like they said, really don't abuse it, and I also hear of this funny one that a lot of some young ladies take. After sexual intercourse, they take antibiotics.
No, that does not work. We've heard people say it over and over. It does not work. And antibiotics fights infection. The sperm is not an infection. It's simple. It doesn't work that way.
At that point in time, that sperm is an infection to them.
But let's even add this. Also, as an emergency contraceptive, you could get to the hospital and then the doctor inserts a loop for you.
Absolutely.
Basically, it works. Once it's done within the first 48 hours, very effective.
Because it makes the womb inhabitable for implantation.
The womb automatically assumes there's a baby inside.
All right, Dr. Okay, do we have questions from our social media platform?
We do, and okay, we got several questions, but I've carefully selected something that suits this topic.
Beautiful.
We have Ijoma through our Facebook platform was asking that can she keep using. She used the word, she wrote ECP, I guess that means emergency contraceptives.
Yeah, the morning after pill.
After every sexual encounter.
That's what I was talking about, you see.
So, that's Ijoma's question. And then someone asked something similar, Jacinta. We can't have men asking most times. I don't know, ladies want to do the questioning. So we have Jacinta asking that, this is what she says, that in some weeks, she uses emergency contraceptives up to 3 times a week.
Wow.
What are the harms?
She should just probably have the normal, take the injectables, or take the daily pills, and then save herself from all of this.
The truth is, if your method of contraception is failing to the point that you have to keep using emergency contraceptives that often, then I think it's time to review that.
I think even the frequency of the sexual intercourse determines the type of contraceptives that
that's why you need to meet your doctor.
Because we already said that each method has a side effect. The emergency contraceptives, just as you explained when you use their tablets, there are hormones, there are chemicals. So they're going to disrupt your flow cycle. So imagine having lots and lots of them. Do you get? You increase the frequency, you increase the intensity of the side effects that you have. That's basically what it does. But I always say this, it's better to have those side effects than to have an unwanted pregnancy.
No.
So if you have to take it, take it, but review with your doctor, really. Take it, but review with your doctor.
Like the name says, it's emergency, under emergency
not routine contraceptive.
Not routine,
exactly. We know, we have heard.
It's amazing. So you've heard it all. I can't believe some people take antibiotics too. That's crazy. I've heard all sorts of things. Coughing after sexual intercourse, trying to do it standing up, jumping up, they don't work. Everything that you've looked at today, these are the things that work, okay? We've been talking about contraceptives. I hope you have been well informed to make some informed choices when it comes to contraception. We continue this discussion on cooltv.cool, and of course, I'm sure you can see our hashtag on the screen as well as our Twitter handle is at
We the doctors.
We the doctors, okay? So drop your questions there and then we'll get back to you. From myself, Dr. Jules.
Myself, Dr. Valeria.
My humble self, Dr. Yvonne.
And Dr. K, as usual.
We're saying bye-bye and stay health smart.
Yes.